A very good evening to all of you. Today we are going to do the pharmacology MCQ challenge. Well, this pharmacology is a very important subject as far as NEET PG or INICT or your second MBBS exam is concerned. This pharmacology has a weightage of almost 25 questions in the NEET PG exam. And some of the questions of medicine and pediatrics and PSM can also be answered on the basis of the strong foundation in pharmacology. So please comment in the chat box the answer to the specific question. If you participate actively, it will be very beneficial for you. Even when you are watching the recording also, you can comment in the chat box that it will give me a driving force to upload more such material. The NEET PG is approaching very fast near. So the more you work hard and the more you practice the things, especially multiple choice questions, the greater the chances of you are getting a good rank. Remember that the difference between a good rank and an average rank is nothing but practice. Practicing the right things again and again. So let's begin with the first MCQ. Clinical effect of vitamin D is reduced by A. Simultaneous ingestion of phytate, B. Simultaneous ingestion of lactose, C. Acidic environment, D. None. What do you think is the correct answer here? Simultaneous ingestion of phytate, simultaneous ingestion of lactose, acidic environment, D. None. Now, what is the clinical effect of vitamin D? The main clinical effect of vitamin D is to enhance the intestinal absorption of calcium. With an average intake of 1000 milligram of calcium, its net intestinal absorption is only 150 to 250 milligram per day. This calcium is absorbed mainly in the duodenum and jejunum, proximal intestine, by an active transport mechanism which is regulated by 125 OH2D calcitriol. Parathormone indirectly promotes the absorption of calcium by increasing the renal synthesis of 125 OH2 D3. Dietary lactose, that is, proteins and acidic environment, promote calcium absorption. On the other hand, phytates, phosphates, oxalates, tetracycline, and alkaline environment impair the calcium absorption. So the correct answer here is A. Simultaneous ingestion of phytates. Please comment in the chat box the correct answer. Now let's move to the next question. Which of the following is a drawback of extended release preparation? A. Frequent high peak side effects. B. Decreased compliance. C. Increased cost. D. No dose pumping. Now, these extended release drugs are associated with gradual rise in drug plasma concentration that is maintained throughout the day, thus avoiding peaks of high and troughs of low plasma concentration. By delaying drug action, the number of doses required considerably decreases and hence compliance increases. Though the cost is higher than the normal preparation drugs, extended releasing drugs, if taken with food, more amount of drug can be released. So dose dumping, which can cause toxicity. So the correct answer here is increased cost. Which of the following drug toxicity can be seen in Crigler-Najjar syndrome? A. Tenofovir, B. Zidovudine, C. Atazanavir, D. Nevirapine. Now this drug with established toxicity in case of Crigler-Najjar syndrome are irinotecan and atazanavir. These drugs are metabolized by glucuronidation. So the correct answer here is C. Atazanavir. An acidic drug is maximally absorbed from A. Stomach, B. Small intestine, C. Large intestine, D. Oral cavity. An acidic drug is maximally unionized in the stomach, but as it has a thick mucosa and small surface area, maximum absorption takes place in the small intestine. So the correct answer here is B. Small intestine. Which are the following? Which are the following is the fastest acting receptor? A. Beta 1, B. M2, C. GABA A2, D. Estrogen receptor. The ligand gated ion channels are the fastest acting receptors. The only ion channel receptor is GABA A, that is GABA A, which is the fastest acting receptor. So among the options, the only ion channel is GABA A. So the correct answer here is C, GABA A. Anandamide is A. Opioid, B. CK1 antagonist, C. D2 blocker, D. Cannabinoid neurotransmitter. This anandamide, it is also known as N-arachidono ethanolamine or AEA, is an endogenous cannabinoid neurotransmitter. The name is taken from the Sanskrit word ananda, which means bliss, delight, and amide. It is synthesized from N-arachidonoyl phosphatidyl ethanolamine by multiple pathways. It is degraded primarily by fatty acid amide hydrolase enzyme, which converts anandamide into ethanolamine and arachidonic acid. As such, inhibitors of fatty acid amide hydrolase leads to elevated anandamide level and being pursued for therapeutic use. So the correct answer here is D, cannabinoid neurotransmitter. The drug in the delivery system given below is for A. Topical use, B. Systemic use, both topical and systemic use, D. None. The correct answer here is this diagram shows a transdermal patch, and this route is systemic use. So the correct answer here is B. Systemic use. Which of the following drug is preferred in WHO stage 4 for the condition given in the picture? See here in the picture you can see prominent pulmonary arteries in the X-ray. And prominent pulmonary arteries indicate pulmonary arterial hypertension. For stage 4 pulmonary artery hypertension, the drug of choice is IV epoprostenol. So the correct answer here is C, ipoprostenol. Acidic drug bind to A. Globulin, B. A1 glycoprotein, C. Albumin, D. None. Now, the acidic drug bind to many natural substances circulate around the body, partly free in plasma water and partly bound to plasma protein. For example, cortisone, thyroxine. Similarly, drugs circulate in protein bound and free state, and the significance is that free fraction is pharmacologically active, whereas the protein bound component is a reservoir of drug that is inactive because of this binding. Acidic drugs generally bind to plasma albumin. Basic drugs bind to alpha 1 acid glycoprotein. Binding to albumin is quantitatively more important. So acidic drug they bind to albumin. Acidic drug are best absorbed in the stomach. Acidic drug are ionized in the intestine. Acidic drug are excreted quickly in alkaline urine. Now coming to basic drug. Basic drug binds to alpha 1 glycoprotein. Basic drug best absorbed in the intestine. Basic drug ionized in the stomach. Basic drug excreted quickly in acidic urine. So the correct answer here is albumin. The drug in the picture is used for A. Breast cancer, B. Routine contraception, C. Emergency contraception, D. Abortion. Two tablets of levonorgestrel given in the picture are used 12 hours apart for emergency contraception. So the correct answer here is C. Emergency contraception. Sugamdex is used for A. Organophosphate poisoning, B. Reversal of neuromuscular blocker, C. Treatment of local anesthetic poisoning, D. Treatment of central anticholinergic syndrome. Now, Sugamdex is a novel reversing agent developed for terminating the action of non-depolarizing muscle relaxant, rocuronium and vicuronium. It is a modified Y-cyclodextrin with high affinity for rocuronium and vicuronium. It encapsulates one molecule of neuromuscular blocker within its molecule, forming an inactive chelate which is excreted in urine with VA of 2 hours. Its side effects are mild precordial pain, nausea, alteration of taste, and rarely allergy. So the correct answer here is B. Reversal of neuromuscular blocker. Mode of excretion of cyclophosphamide is A. Lung, B. Liver, C. Kidney, D. Skin. Cyclophosphamide is primarily metabolized 80% and metabolites are excreted in urine. 10 to 20% is excreted unchanged in urine and 49% is excreted in bile. Please click the link in the description box to join the 2-day Ultimate NEET PG Breakthrough event, which covers all the 19 subjects in a holistic manner, which will boost your preparation and boost your score and increase the necessary confidence, which is very much essential to crack the NEET PG exam. So please click the link in the description box. The first 10 students who click the link in the description box will get this class absolutely free. This 2-day ultimate NEET PG breakthrough event, ultimately free. Attend live. It will be very beneficial for you. What is the type of receptor given in the picture? A. GPCR, B. Ion channel receptor, C. Enzyme link receptor, D. Nuclear receptor. Well, the type of receptor given in the picture is a ion channel receptor. Here you can see the pentameric structure. Alpha, beta, gamma, delta. Pentameric structure is there. The receptor is made up of 2 alpha, 1 beta, and 1 delta subunit. This is a ion channel receptor. So the correct answer here is B. Duration of action depends on A. Clearance, B. Rate of elimination, C. Bioavailability, D. On. The duration of action depends upon clearance, rate of elimination, bioavailability, and all of them. So correct answer is D. Which of the following drug can cause thyroid dysfunction? A. Amiodarone, B. Ampicillin, C. Abutolite, and D. Acyclovir. Now the drugs which cause hypothyroidism are lithium, sulfonamide drugs, phenobarbital, phenytoin, amiodarone, para-aminosalicylic acid, rifampicin, carbamazepine. So the correct answer here is A. Amiodarone. Which of the following anti-migraine drug might have caused the side effect seen in the picture? Here you can see there is a gangrene, and this gangrene can be caused due to peripheral vasoconstriction, which is quite severe, and it has occurred in the end arteries. So this ergotamine can cause severe peripheral vasoconstriction and gangrene in organs with end arteries. For example, like fingers. So the correct answer here is D. Ergotamine. Now let's move to the next question. Dopamine, all of the following is true. A. Cause increase in GI ischemia. B. Positive inotropic. C. Improve renal perfusion. D. Cause vasoconstriction. This dopamine acts on D1 and D2 receptor and adrenergic receptor, that is alpha 1 and alpha 2 receptors also. It has no action on beta receptor. At lowest effective dose, it stimulates D1 receptor in renal and mesenteric blood vessels and improves the renal and mesenteric perfusion. At moderately high dose, it acts on beta and positive inotropic. At high doses, it activates alpha adrenochrome receptors. So the correct answer is causes increase in GI ischemia. In fact, it increases the splanchnic circulation. The side effect of digitalis are all A. Ventricular tachycardia, B. Vasodilation, C. Nausea and vomiting, D. Ventricular bigeny. Now, common signs and symptoms of digoxin toxicity are the cardiac adverse effects are ventricular arrhythmias, atrioventricular block, atrial arrhythmias, and sinus bradycardias. Now, non-cardiac side effects are anorexia, nausea, vomiting, abdominal pain, visual disturbances, halos, red-green or yellow-green vision, photophobia, fatigue, weakness, confusion, delirium, psychosis. So the correct answer here is digitalis in fact causes mild vasoconstriction. Digitalis does not cause vasodilatation. So correct answer here is vasodilatation. Antiandrogen used in heart failure is A. Carvedilol, B. Sampratelol, C. Spironolactone, D. Abiraterone. Now, spironolactone and eplerenone are aldosterone antagonists. They are used as potassium-sparing diuretics. Their diuretic effect is quite feeble, but in congestive heart failure, these drugs reduce the mortality at dose lower than the diuretic dose by antagonizing the effect of aldosterone. Spironolactone also possesses anti-androgenic effect. So, correct answer here is spironolactone. Which of the following drug might have caused the side effect given in the picture? A. Antacid, B. Bismuth, C. Cisapride, D. Sacralfate. Bismuth can cause black discoloration of stool as well as tongue. So the correct answer here is B. Bismuth. Gemcitabine used in mainly which cancer? Colorectal, breast, pancreatic, craniopharyngioma. This gemcitabine is used for the pancreatic cancer. So the correct answer here is C. Maximum liver toxicity is seen with which anti-TB drug? Now, not hepatotoxic are ethambutol and streptomycin. Hepatotoxic are pyrazinamide and isoniazid are the most common cause. Pyrazinamide causes the most severe. Rifampicin is less common and less severe. So the correct answer here is pyrazinamide. It is most hepatotoxic. Fastest acting antithyroid drug are A. Iodides of NaK, B. Propylthiouracil, C. Methimazole, D. Nitrate. It is iodides of Na and K. They are the fastest acting antithyroid. Natalizumab is used in treatment of multiple sclerosis. Special feature of Glargine insulin is A. It produces smooth pithless effect. It is not suitable for once daily administration. It remains soluble at pH 7. It can control mealtime hyperglycemia. MEA. It produces smooth pithless effect. Now, insulin glargine is a long-acting biosynthetic insulin. It remains soluble at pH 4 of the formulation and precipitates at neutral pH on subcutaneous administration. The onset of action is delayed. It produces a smooth peakless effect. It is suitable for once daily administration. Low incidence of nighttime hypoglycemia. It does not control mealtime hypoglycemia. Mechanism of action of trilostane is A. 11 beta hydroxylase inhibitor, 1 alpha hydroxylase inhibitor, 3 beta hydroxysteroid dehydrogenase inhibitor, 7 alpha hydrolase. It is 3 beta hydroxysteroid dehydrogenase inhibitor. This trilostane, sold under the brand name Vitoril, among others, is a medication which has been used in treatment of Cushing syndrome, Conn syndrome, postmenopausal breast cancer in humans. It was withdrawn for use in humans in the United States in 1990s, but was subsequently approved for use in veterinary medicine in 2000 to treat Cushing syndrome in dogs. It is taken by mouth. Medical use: Trilostane has been used in treatment of Cushing syndrome, hypercortisolism, Conn syndrome, hyperaldosteronism, and postmenopausal breast cancer in humans. When used to treat breast cancer, trilostane is administered in combination with corticosteroid to prevent glucocorticoid deficiency. So the correct answer here is C. 3-beta hydroxysteroid dehydrogenase inhibitor. Treatment of choice for cheese reaction is A. Prazosin, B. Pentagocin, C. Phentolamine, D. Phenoxybenjamin. Cheese reaction. Certain varieties of cheese, beer, wines, pickled meat, fish, yeast extract contain large quantities of tyramine dopamine. In MAO-inhibited patients, these indirectly acting symptomatic amine escape degradation in intestinal wall and liver. Reaching into systemic circulation, they displace the large amount of Na from adrenergic nerve ending, causing hypertensive crisis, cerebrovascular accident. This can be treated by IV injection of a rapidly acting phentolamine. Prazosin and chlorpromazine are alternatives. So the correct answer here is phentolamine. Essential drug. Essential drug. A. Included in the national pharmacopoeia. B. Should always be present at PHC. C. Those that satisfy the primary healthcare needs of population. D. Life-saving medications. These essential drugs, those that satisfy the primary healthcare needs of population. WHO has defined essential medication as those that satisfy the priority healthcare needs of the population. Post-marketing surveillance included in which phase of drug clinical trial? A1, B2, C3, D4. It is 4. Surveillance after marketing, that is after the drug is out in the market, is a part of phase 4 of clinical trial. It includes follow-up of patient taking the drug and adverse drug reaction reporting, as well as looking for newer treatment indications. Which of the following is the most active against slowly dividing tubercular bacilli? A. Isoniazid. B. Rifampicin. C. Streptomycin. D. Ethambutol. It is rifampicin. Drug contraindicated in G6PD deficiency is chloroquine, primaquine, quinine, AL. It is all. Which of the following anti-cancer drug are competitive inhibitors of tyrosine kinase? It is imatinib and sunitinib, B. Letrozole, Vicaltrimab, Fulvestrant. It is imatinib and sunitinib. Which of the following drug might have caused the effect given in the picture? A. Somatropin, B. Octreotide, C. Insulin, D. Goserelin. It is insulin. Ranibizumab is a monoclonal antibody against A. IL-6, B. CD20, C. VEGF, D. EGFR. It is VEGF. Please click the link in the description box to join the 2-day ultimate NEET PG breakthrough event. It will be very beneficial for you. It it covers all the 19 subjects in a holistic manner so that there is a drastic improvement in your rank the more you practice. And also please attend live this MCQ challenge every day at 7 p.m. And please share this video with as many friends as possible. Wishing you all the best.